A fiberoptic endoscopic evaluation of swallowing, also known as FEES. In this slide, I gave you a quick overview of what a FEES is, but let me go more into depth with it. A FEES helps test and determine if you have trouble during swallowing when food or liquid moves through your throat. It uses a thin, flexible tube with a tiny camera, which is called an endoscope, that is gently inserted in your nose, often after numbing spray has been used. The scope sits on your epiglottis and lets the speech-language pathologist see your throat structures like the larynx and the pharynx, and your trachea, which is then shown on a video screen to help evaluate how your swallowing is going. What happens during the procedure? A FEES test can be performed in various settings, including hospitals, at bedside, or in clinic, outpatient clinics, rehabilitation centers, and so on, because the equipment is portable. A FEES test can be anywhere from 20 minutes or longer. It just depends on the patient, and all of our experiences may vary. During this test, you will be seated and awake, and anesthetic will be sprayed in your nose, so that you don't feel the endoscope go through the nose. Your SLP will insert the endoscope through the nose and down into your throat. You may feel a mild discomfort during this procedure. Some people also experience tightness or almost a gagging sensation. The SLP will use the video screen to see how well you are swallowing. If you're aspirating, your SLP will look at a number of factors. These include how well the secretions are when swallowing, how well breathing is when you're swallowing, and also you'll be fed a few various items. You can be fed crackers, various liquids, just so that they can see what all is going on. On this slide, this is a list of who a FEES may be used for. FEES is for people who have trouble swallowing or who are at risk, such as those who have a stroke, neurological disorders, and the rest listed. It helps identify if food or liquid is entering the airway, which is called aspiration. And it checks on how well the throat muscles are working during swallowing. A FEES is used to diagnose swallowing problems and guide safe eating and treatment plans. Let's talk about the pros of a FEES. With a FEES, we use a camera, so you're not exposed to radiation, so it can be repeated as often as needed without risk. FEES is portable and can be done at the bedside, which is ideal for patients who are immobile or who are in critical care. It provides a clear, real-time view of the pharynx, larynx, vocal folds, and how they are functioning during swallowing. It can identify aspiration, especially silent aspiration, which is without a cough, and see residue left behind after swallowing. Unlike the MBSS, FEES shows how well a person can manage saliva secretions, which is a key part of airway protection. Since there's no radiation limit, you can take your time, test fatigue, multiple food types, or real meals. Also, the therapist can try different strategies or positions during the exam and see what works right away. So these are just a few limitations of the FEES. So during the FEES, there may be whiteout moments. During the actual swallow, the pharynx closes around the scope, causing brief whiteout from the tissue coming in contact with the camera. You can't see the actual moment the bolus flow through the pharynx or whether it enters the airway during the swallow, only before and after. We can't see the esophageal phase. It consists of the upper esophageal sphincter opening, the esophageal clearance, and reflux. Also, it may cause discomfort within the patient. Oftentimes, patients who have anxiety, this may not be good for them. It gives you a gagging sensation, or if you're about to sneeze, that can be very discomforting. And in rare situations, there are nosebleeds that occur during this procedure. This may not be suitable for patients who have significant nasal obstructions or who have experienced recent facial trauma or surgery and things like that. So this is just a case study example that we went over in a course that I'm currently in. And I gave my reasoning as to why I would do a FEES. So if you have a chance, I will go through and read the case study and just pick apart pieces as to why we would do a FEES instead of an MBSS.